Good morning. Thanks for joining me on the live today. We're going to talk about EPM. This is a horse that just came in, and the first time I rode him, I knew right away that he had EPM. It's actually a pretty mild case. It's kind of at a level that if more people would diagnose and treat at the level his is, people wouldn't be so scared of EPM. But um, it's kind of up to the owners to recognize, hey, I need to call the vet to have this looked at. And he actually was looked at by a vet 2 months ago for something different. And the vet wasn't evaluating him for EPM, so the vet didn't see it. So I'm going to get on him here in just a minute, and we'll talk about what I saw that led me to that conclusion. He's here for some just general manner issues. He doesn't want to go where the rider tells him to go, doesn't have much whoa, just kind of general those manners, just basic riding manners. And that's what he ended up, that's what he is here for, what he originally came for. So we're going to talk a little bit about that, but mostly we're going to talk about what I saw that led me to get with the owner to have him evaluated for EPM. I think his case is relatively mild, and his meds came in yesterday. We'll go more into this. His owner is going to be bringing me his meds today, and we'll start him on his meds. He's not started yet. Let's walk him around just a little bit. So some of the issues that he originally came for, he just generally wasn't very respectful of the owner, not very respectful of the owner's leadership. And one thing I noticed when I started handling him is he was very snorty about a lot of things. And what I started doing is every time he snorted at something, which he hasn't done it since I've been out here, he's been here about 10 days, something like that. So I've worked with him a good bit. Every time he snorts, I'll change directions. Right there, and that was just a little snort. I'll stop and back him up. Go the other way. Just little things like that to be a leader. Just for me to be the leader and him to recognize me as a leader so that when he sees something that he's worried about, snorting about or whatever that he's worried about, right there, he kind of looked and pulled. Instead of focusing on that thing, I want him to focus on me, to ask me, what do you want me to do about this thing? Um, Typical leadership stuff that we've talked about in quite a few videos. I don't think his EPM and the leadership issues are related any kind of way. Totally separate. I don't think the EPM is affecting his behavior at all. Two totally different things. So let me go ahead and get on. I don't have a tape. I don't have a stick. But I measured him with a tape measure, and he taped out at just under 18 hands. About 17.3, 17.3 and a half, something in that range. So he's a big boy. He's just under 6 feet at the withers. So he's a good bit taller than I am. He's some sort of draft warm blood cross. Not exactly sure. Given the white socks and the blaze, I'm thinking maybe Clydesdale, Dutch warm blood, something like that. But I don't really know. Some sort of draft warm blood cross. See, I'm on the top step of the mounting block. I got to get my leg way up there. Let's do that again. He generally has been standing pretty good for me to get on. Yeah, he's don't really know. I don't know exactly. His owner might know. I think he is some sort of draft warm blood cross with the white socks and the blaze. I'm thinking maybe Clydesdale. Not really sure. My guess would be Clydesdale Dutch warm blood, something like that. But I don't really know. Get your head straight. Well, usually pretty good to get on. All right. Start off with my left circles. I was back humped up a little bit today. So, as I'm walking these circles, I'm starting my left first. Let's go forward. Watch how he handles his back feet. I think the EPM is affecting his back end. And this direction, he actually walks pretty decent. When I change directions, you'll see the issue that I'm seeing. I'm going to walk him a pretty good bit. He's pretty fresh today. Lots more forward than I have had. If you got any questions about him, put them in the comments. You got any questions yet while I'm walking these circles? Okay. Okay. Florida, Colorado, and Michigan. Happy to have you join me. He's starting to settle now. Not sure what that was about. It actually has been pretty good getting on him. Then I just rode him yesterday, and he was turned out last night. So as I'm walking these left circles, he's tracking pretty good in the back. I'm going to change directions again. I'll tell you, before I change directions, I'm going to bring these circles in smaller because it really shows when I go smaller. There we go. Much smaller, tracking pretty normal. Okay, now I'm going to change directions to the right. Start off with a little bit bigger because he feels unconfident this direction. So what I'm feeling is I'm feeling his back right leg tracking, maybe even crossing over the back left leg. I've been working on the physical therapy part, and I think I might already have some improvement. So let's go back to the left again. So when I'm walking left, I feel his body arcing to the left and the back end generally following the front end. And right there, it's pulling on me just a little bit. A bit of a hill there. Now let's go back to the right. Now what I feel here is imbalance to the right. The back left leg feels weaker than the back right leg. And he feels like that back right leg is stepping kind of under and centered with his body in an effort to kind of support himself more with his right leg than the left leg. All right, what's your questions? Okay, good morning, Laura. She said, what are some telltale signs of EPM? So when it gets serious, the signs are basically uncoordination in either the front or the back. It can affect either one, usually either one. I'm sure it could affect both, but I've never seen it affect both. And it's that uncoordination. And with EPM, there's no pain associated with EPM. It's actually the opposite. It's almost like when your leg goes to sleep and your leg's a little bit numb and you go to walk off and one leg's asleep and it's a little numb and you're using the other leg to more center yourself. That's what it feels like to the horse. And in walking his circles, I could feel that this back left leg was a good bit weaker than the back right leg. And I felt like that back right leg was stepping more to the center of the body. And it was almost like the back right leg was doing most of the work of the back end. And that's the first thing that keyed me in. Now, I've been riding him about 10 days doing the physical therapy part, which has helped. And it's not as drastic now as what it was in the beginning. I have a video of the first ride in the beginning that I showed to the vet. Might post it on Patreon, I'm not sure. I have also been working on using my right rein and right leg to get more right bend when I'm going right and slowing down his forward with my left hand to shift his weight to this back left leg. And that is most of the work that I've been doing to strengthen that back right leg up. So if I ask him to bend to the right, leg yield, he's pushing forward. So we're going to have to work on that. That's a training issue. That has nothing to do with the EPM. A little bit of leg yield, a little bit of slowing him down. That shifts his weight to the back left leg. When I talked to the owner, bending to the right had been an issue with her. And when I first started riding him, it was an issue with me. He didn't want to bend to the right. And what was happening, he was tracking with his hip to the left. In the process of tracking his hip to the left, he was bringing his shoulder down to the right to balance himself. The front was compensating for the back. And that's how he was getting himself what he felt balanced. But physically it wasn't, but that's what he felt. So when I first started asking his shoulders to go over to fix the shoulders to get them better balanced, he was really resistant, like was resistant when I just asked because he's trying to push through because that's not what feels balanced to him. Yes.
Okay, does if for some reason it turns out to be just a conditioning problem with being on EPM that is hurt at all?
Okay, good question. So if it turned out to be just a conditioning problem with EPM meds hurting, no, the EPM meds would not hurt him if it did turn out to be just conditioning. But I performed a tail pull test. The vet performed a tail pull test and some other groundwork tests. And between that and the asymmetrical body, we're both confident that it's EPM. The meds will not hurt. They're very expensive. That's the thing. You don't want to give them because they are very expensive, but they're not going to hurt him. That'd be like giving your horse a wormer when they don't have worms, when they don't have parasite. Might not necessarily want to do it, but it's not going to hurt them if you do. The just like any other EPM is neurological. It's a parasite that affects the spine basically, and it causes numbness to an area of the horse's body. It could be any area. Normally, it's either the front legs or the back legs, and with him, it seems to primarily be back left. I'm sure if it was left to go on, it would probably end up affecting both sides of the back. Any other questions? So as I'm walking him here, I'm bending him to the right, asking the shoulders to move over to the left. And in the process of doing that, I'm asking him to load up this back leg, do physical therapy with the side that's affecting that has been affected. Just like any neurological thing that goes on with a person, physical therapy is very, very important for the recovery. And with a horse with EPM, you can give the meds and clear the parasite out. But if you don't do the physical therapy, you're not going to teach the horse to travel correctly again. Once the horse's body is traveling, compensating for the EPM, it's usually going to stay that way unless you do the physical therapy to correct it. A lot of times when I hear people say, well, I treated my horse for EPM, but it came back, didn't necessarily came back. I think in a lot of those situations, you're still seeing the physical symptoms because the horse didn't get the physical therapy to correct the physical symptoms. When you have neurological situation like EPM and you create weakness in one area of the horse, then you're going to have some muscle atrophy in that area. And if you don't work that area to correct that muscle atrophy, then it's not going to get fixed. It's kind of like if you are very, very right-handed or one eye is very, very dominant, you try to use the other eye or the other hand or the other leg, whatever, to get a little bit better balance. As riders, we are right-handed or left-handed, and we work to get better balance so that we can be better centered on the horse. And well, you can do exercises, you can do exercises on foot, you can do exercises from the saddle so that you get better centered. And that's basically what the therapy, the physical therapy for him entails, is exercises to help him get better centered to use his back end correctly. Another question?
Is EPM more common in draft or draft cross larger breeds?
Is EPM more common in draft, draft cross, or larger breeds? I don't think the breed or the breed type really makes any difference. EPM is transmitted by fecal matter. It's a parasite. It's normally in possums, but it can be in other animals too. And what happens, that fecal matter will get baled up in your hay. And when you give hay, the horse ingests it, and that's where the parasite comes from. Um, I've been told that all horses are going to test positive for it because all horses have ingested the parasite. But for some reason, some horses are able to fight it off better than other horses. And the horses that are not able to fight it off, then it gets in the spinal cord and starts affecting the nervous system. That's why the blood test isn't really very effective because a lot of horses that show that they have EPM, they show the presence there, really doesn't have any physical symptoms. So the blood test isn't very helpful. That you can do a spinal tap, that's more helpful. That's pretty evasive. The old-fashioned way is just physical movement, looking at their physical movement, doing a tail pull. That's really the most reliable way to diagnose EPM. And I get some horses that come in that just conditioning is going to fix an incorrect body movement. And I put out a whole bunch of videos about that, talking about asymmetrical movement and the horse being out of whack, carrying their body, and different physical things to help that. With him, I think it was more. It is more than just physical needing conditioning, because of how he reacts, how he's trying to center himself with his right leg, how much more dominant his right leg is than his left leg. A horse that's just not carrying themselves correctly, they'll be out of whack, but they won't be so out of balance in the back end or the front end. Another question?
Is Marquise still the standard treatment?
Yeah, Marquis is a standard treatment. That's the best treatment you can put a horse on, and that's what he's being put on. There are some other treatments out there, some compounded stuff, some stuff that's not FDA approved. Um, uh, I have used some of that stuff and had good results. I have seen some of that stuff and had not good results. I was actually involved with Auburn University with a horse with EPM. The vet put him on some non-FDA approved EPM meds, and actually the meds ended up killing the horse. There's actually a lot behind the scenes going on that I really can't talk about that. But Marquis is that's the go-to medicine for to treat EPM. That's I think the only FDA approved med for EPM, but I'm not positive.
And does EPM clear itself out after a while, or does it have to be treated with meds and physical therapy?
Okay, does EPM clear itself out after a while, or does it have to be treated with meds and physical therapy? It will not clear itself out. Some horses, I think, can have a low degree of EPM for years and it not get worse. And I've seen some horses that get really bad really quick. Kind of think about it as an intestinal parasite, but instead of being in the intestine, it's in the spinal cord. So once that parasite gets in the intestine or in the spinal cord, it's typically not going to clear itself out on its own. Um, Intestines, it's possible in certain situations. Spinal cord, definitely not. So you have to treat it to clear it, and you have to do physical therapy. You have to do physical therapy to correct the muscular issues that were created from the EPM. You can clear out the actual parasite, but the horse still not travel correctly if you don't do the physical therapy to correct the issues with the muscles. Um, I actually just sent a horse home maybe 2 weeks ago that had been treated for EPM before it came to me, and it came to me specifically for the physical therapy part because that is just hugely important when you're treating EPM. It's hugely important when you're treating a lot of things, but especially with EPM, it's kind of like a person with a spinal cord injury. Uh, you the spine might heal, but you have to walk again. You have to use your hands again. And it's the same thing with the horse. And to a horse, there's no pain involved with EPM, but it's numbness. If you think about if you're sitting and one leg goes to sleep and you go to stand up and walk, what you're feeling, I think, is kind of similar to what a horse feels. The one leg is strong, working good. The one leg is a little bit numb. So the numb leg isn't used as good because it's a little numb, and the other leg kind of takes over. And I think that's what's happening with him. His left leg, I believe, is a little bit numb, not as strong, and his right leg is a little bit stronger. And as I'm walking around, it's going to be hard to tell walking, but as I'm walking around, you can tell that he does have a little bit of muscle atrophy in this left hip. It's not huge, it's not really big, but looking at him, it's probably going to be hard to tell under saddle. His left shoulder is way better developed than his left hip. On his right side, it's better balanced. His right is still a little bit weaker than the front, but it's not as big a difference as his left side.
And how long do you have to give the med?
Okay, how long do you have to give the meds? Typically about 30 days if you have a real serious case. Sometimes you'll treat it longer. Most milder cases, like I think he is, will be 30 days. And that's something that we'll have the vet involved with to decide exactly that. Um, EPM is something that it really helps to have a vet involved because I've even seen some situations like I worked with one horse with Auburn University, and I documented the work that I did with the horse throughout the process. And we adjusted the meds, adjusted the dose, and adjusted the physical therapy that I was doing as the horse progressed. And that helped a lot between me and the vet working together to help that horse recover. I typically get maybe one or two horses a year that come in that I have to call the owner and say, look, I think we need to look for EPM, look at EPM. And then I usually get several more a year that come in for the physical therapy part. I don't think there's many trainers around that have had the experience rehabbing after EPM as I have, especially working with some universities. And I've even seen vets say, absolutely do not send the horse to a trainer, which is very bad thing to do because you have to do that physical therapy to rebuild the muscles. Another question?
Yes. Have you ever seen sidewinders develop years after EPM diagnosed and treated?
Okay, have I seen sidewinders develop years after EPM was diagnosed and treated? I don't think I have seen that personally. I assume it could be possible. Uh, I don't know. I have not seen it. I would assume that it would be possible, but not connected, not associated. But I really don't know. I've not dealt with that before.
Okay, another question from Dusty. Could you explain how to manage your physical therapy program with a horse with EPM, as in isolating where they're weak and such, and how to approach the training?
Good question, Dusty. So how to isolate where the horse is weak and how to approach the training. So with him, with walking the circles that I did in the very first evaluation, I could tell that this left hind leg was weak. And I could tell that his right hind leg was stepping more centered of his body line to compensate. And then we did a tail pull that actually confirmed that. So using just basic horsemanship, come around so you can see me a little bit better. So right rein, right leg creates right bend. I slow that down a little bit with my outside hand. That's my brake. What my goal is to ask him to use this left leg more. Shift his weight to the left leg, engage it more. So by asking him to bend to the right, leg yield over, slow down his forward, I'm asking that left hip to do a little bit more work. Now, another thing that I need him to do, we've been working on his backup. And this is going to do even more than that leg yield, but he didn't have any backup when he came. So I've had to create a backup, teach him how to back up. So the backup zigzag exercise that I do that a lot of you have seen, back up, move the shoulders over, back up, move the shoulders over. So let's try that. I've tried it before and I didn't get much, but let's see. Let's back up, left rein, left leg, move the shoulders. Now we're going to back up again, right rein, right leg. Whoop, another step. Right rein, right leg. Move the shoulders the other. There we go. So by moving the shoulders back and forth, I'm trying to get him to pivot on one back leg or the other back leg. And as I get him to pivot on this left leg more, that's going to strengthen that leg up. That's going to build, he's going to load that leg and pivot on it and build up his strength. Squeeze with my legs, just like I typically teach backup. As the shoulders, left rein, left, whoop, he's pushing forward again. Left rein, left leg, bring the shoulders to the right. Go right back to another backup. Right rein, right leg, pivot the other way. See how much he's pushing through? That has to get better because if he's pushing through, he's not loading up this leg. So I've been spending a lot of time practicing his backup. so that he doesn't push through. Right there, he walked forward again. We're going to back right back up again. Good boy. When a horse moves off forward, I've talked about wanting to engage the back end, ride the horse forward from my seat, from my legs. And when I ride the horse forward from my seat, that teaches the horse, or that helps the horse engage from the back end and push forward. When the horse walks off forward, leans in, and walks off without me engaging the back end, then the horse is pulling with their front feet. So I don't want him pulling with his front feet to walk off, because then I'm just exercising the front end. I want to exercise the back end. I want him to push off with the back because I engage my core and my legs to ask him to push back there. So the first thing I have to do to get there is him not lean through my hands when I make contact. Now let's see if we can ride off to a collected forward. There, that was a little bit better. Now let's go ahead and walk a right circle. Ask for a little bit of collection. See how he's stepping pretty big, which he's a big horse. He should step big, but I want him to stay soft on my hands. Right there, he went to look to the left, so a little bit of right hand, right leg. Don't really want him to carry his head that low. He's getting a little bit behind the bit, evading the bit a little bit. So I'm gonna give him a little squeeze, little left leg. There we go. I want him to lift his back up and engage the back end. Let's do another left rein, left leg. Now we're going to come around and come to a stop and ask for another backup. I want him to stop soft. There we go. A little bit of squeeze with my legs. Let's get another step. There we go. See, his head's going up. Once in a while, I get a soft head round and then a step back. That's really what I want to develop. When I can develop that, I get a round neck, get the shoulders up, then he's going to load his back end better and allow me to exercise this back left leg better. It's all connected, using his body correctly. The same body frame that I want to exercise this EPM to correct this muscular issue, he needs to carry himself correctly. It's just that in order for him to be able to do that, we've got to correct that medical issue. Another question?
How long do you give the meds, and is it injections or pills?
So he's probably going to get it for a month. There's two different ways. It can be pellets or it can be paste. I prefer to do the pellets because a lot of horses, after 30 days of putting the paste in their mouth, they start getting hard to paste. Especially with him being so tall, it wouldn't take long. I wouldn't be able to get up high enough to put the paste in. Normally, you use the paste for more severe cases. He's going to be getting the pellets, probably 30-day treatment, and I expect that it'll all be done by then.
Is EPM diagnosed later in life, or can it appear at any time?
Okay, is EPM diagnosed later in life, or can it appear anytime? It can appear anytime. I've seen it in young horses. I've had 2-year-olds, 3-year-olds sent to me to work with that had it, and I've seen older horses that had it. The only issue that goes on there, the only consideration, a young horse that has it often will recover quicker and easier than an older horse that has it. A lot of times you see EPM with a 17, 19-year-old horse. They've had a mild case of EPM for a long time that started the flare, and that's a lot harder to treat and a lot harder for them to recover from. Young horse that has it, like him, they typically recover, and it's normally not an issue again.
Okay, did you do therapy with him on the ground before you continued in the saddle?
Did I do therapy with him on the ground before I continued on the saddle? The groundwork that I did, in fact, I posted a video on Patreon this morning, I think, of doing some groundwork with him. I did do some groundwork, but it really had nothing to do with the EPM. It was just getting him to have better manners on the ground. If it was a horse with a serious case that I felt the horse was not stable enough to support me, then I would have done some work on the ground first. He has a mild case, and I think a lot of horses out there have a mild case like he does, and the owners don't realize it to get help. And that's really what I want to accomplish with this video, is for you to understand what's going on so you can recognize the symptoms and get help for your horse.
Is it more predominant in certain states?
Is it more predominant in certain states? Yeah, prominent. It could be. It's generally passed by raccoons or possums, probably raccoons. I've even heard of some cats transmitting it. I assume that states that have more numbers of those, it would probably be more prominent than other states. I would assume that maybe some of the colder northern states that don't have as many possums and raccoons, maybe they have less cases of it, because that's generally how it's transmitted. I have a lot of followers in Europe, and it seems like it's very, very rare in Europe. It's pretty common over here in the States. And I think it's just been recently that people have become better at identifying it. You hear a lot more about it than you used to, but I don't think there's any more cases than there used to be. I think we're just, as horse people in general, we're getting better at identifying it, which we're better at getting the horse help. So I don't think it's any more prominent than it used to be. I think we're just getting better at identifying it to get help. Let's walk a few left circles now. Do a few leg yields off my left rein, left leg. Then I'll come back and back up some more. He needs to develop a better backup to help with his back end, but he also just in general needs better backup. You see, when I ask him to back up, he gets his head up, he gets stiff in the front end. As he gets softer in the front end gets softer, gets lighter. Then the back end is going to get stronger. He's going to start engaging his back end. So that's why I need a rounder back up with a softer shoulder. And that's going to shift his weight to the back end and help strengthen the muscles in the back. So now let's walk some left. We're walking left circles. Let's add a little bit of left rein, left leg. Pushing into my leg a little bit. I am riding him with spurs so that I can move the body part like I need to move it. Now you see, as I pushed, his head was going up. His head is going up as he's pushing with his left leg. Let's slow this down. Push. There we go, and I'll release. His tendency is to just kind of push through. And I've worked a lot of draft horses, and that kind of tends to be a common mentality for a lot of draft horses. They just kind of lean in and push through. And that's just kind of general for that breed. Just kind of like certain horses have certain breeds have certain tendencies. That tends to be a tendency for draft horses. But he can still learn to not push through. Ooh, there we go. Move his body and get a little bit softer. I just have my plain D-ring, smooth mouth, single jointed snaffle on him. Nothing big about it. His mouth is a little wider than typical, just matches his size. And he could use a little bit wider bit. He's getting along with this one fine because of the D-rings. I'd kind of like to put my heavy snaffle bit on him, but the way those rings are, I know it would pinch the corners of his mouth. So working with what I got. And his owner has been riding him in, I think, a 5 1/4 inch mouth bit. And that really fits him a little bit better. But he's working fine with this. It's not pinching his mouth. Any other questions?
Yeah, first a comment. Great info. I always thought EPM was progressive and deadly.
Yeah. So who commented that? Yeah, Lisa Morris. I always thought EPM was progressive and deadly. In the past, it often was, because we weren't very good at identifying it. So that, yeah, it often was, but because as generally in the horse world, we're getting better at identifying it so we can treat it, then it's less often progressive and deadly.
Another question. Any ways to prevent EPM? Supplements or medicine?
Is there any way to prevent EPM? There is no supplement or med that I know of to prevent it. It's kind of it's one of those things that, in general, all horses are going to be exposed to in the U.S. And most of the time, a horse doesn't have an issue. The horse's natural immune system can fight it off. Once in a while, for whatever reason, you have a horse that it affects. So there's no way that I know of to prevent it.
Child abortion are common as EPM is in Minnesota. We have possums and raccoons. They are having cases of EPM death
Yeah.
in Minnesota.
A viewer in Minnesota said they have EPM there too. They have possums and raccoons, and they have EPM there. Uh, as far as I know, any state that has possums and raccoons is going to have EPM. Uh, I don't know that for a fact, but that, since that's how it's transmitted, I would expect that. I think I'm going to end the live on that for today. And I appreciate everybody for joining in and watching, and your great questions, interacting. I hope that with this video, we can kind of bring more attention to EPM so that you can identify it as an issue, maybe an issue, to have your vet look at if you have that issue with your horse. Um, if you have any questions about it, if you think your horse might have EPM, have your vet out and take a look. It's only cost you a vet check to have it looked. Most experienced vets are pretty good at diagnosing it. Um, and I think the more we communicate with our vets about concerns about EPM, the better the vets will be at diagnosing and treating it, and uh, the more affordable the treatments will become because they are expensive.
A question.
Anything? Oh, question before we stop? Okay.
Yeah, Angela, I like that head carriage, although not what we see a lot these days. Does he have his shoulders properly engaged?
Okay, so she asking if does he have his shoulders properly engaged? No, he does not, and that is partially because of the EPM. That left hip is weak, which puts his weight on his shoulders because he's not able to round himself correctly. So a big part of what I'm doing to ask him to is to ask him to lift his shoulders, engage correctly, round correctly, and engage his back end. That's a big part of what I'm asking him to do to help strengthen that back end up. So we'll end it on that. I appreciate everybody's interaction and everybody's questions. This is Bob. I'm calling him Bob 2 on the playlist so he doesn't get confused with my Bob back there. And he'll have a playlist on YouTube. I've already posted a couple of videos of him on Patreon. Until next time, thank you for watching.